Good afternoon, everyone. I was going to say, please have the panelists come forward, but they all are coming forward, which is great. I'm John Auerbach. I'm the president and CEO of Trust for America's Health. I think that having that video right before this panel is very helpful because what she was mentioning was really the issues that arise for the students of this age are really about complicated problems that are not just problems that can be resolved in the classroom setting or in a school setting, even when you have incredible school leaders like the ones that we've heard from this morning. But in fact, clearly what we need is the good work that's going on in schools to be matched by good work that's going on in multiple other sectors and with multiple other disciplines in partnership with the schools, and we're going to be hearing about a number of those efforts. And we also need to be thinking about policy change so that not only can we address the immediate issues that are facing the young people and their families, but we can think about how can we move ahead, get ahead of the game so that we don't have as many students whose families are facing those issues and who are facing those issues as well. So we have, at Trust for America's Health, we actually prepared a report this year that focused on adolescent health, and its focus was on cross-sector, and we're going to be hearing a lot about cross-sector. We looked at from justice, from healthcare, from public health, from education, and what was clear was that very often those disciplines work independently of each other. They may be working with the same families, they may be working with the same adolescents, but they're often working independently of each other, and that can be counterproductive. And so thinking about the ways of working together across the different disciplines and out of silos so that the families and the middle school students benefit the most is a goal. And I think the diversity of the panel members today will reflect the richness of the possibilities in terms of drawing in those other sectors and disciplines. So as you can see, there are 7 people sitting here. And what I'm going to do is introduce them by their discipline or by their sector first and have those people speak, and then introduce the next group beyond that, just so that you can keep track of which sector and discipline is being focused on. And so to begin with, we're going to be hearing from public health and public health and stretching into human services. And we have 2 wonderful leaders representing those sectors. First, you'll be hearing from Dr. Barbara Ferrer, who's the director of the Los Angeles County Department of Public Health, and Lisa Warhus, who is the director of Children and Youth Initiatives at the Alameda County Health Care Services Agency. It's very hard for me not to introduce them with a long description of their incredible achievements and qualifications, but in the interest of time, I would encourage you to look at the packet and so that you can appreciate that. But needless to say, the people on the panel today are incredible leaders with many years of dedicated experience and enormous skills. So Barbara, we'll begin with you. Oh, there's a clicker up here. So I think, yes. Yeah, I think it will be easier for each of the speakers to come to the podium.
Okay, thank you. Thank you so much, John, and thanks to all of you for being here today. And it's an honor. I want to acknowledge and thank the organizers, Josh, Carla, Brittany, for allowing us to get together. Appreciate the opportunity. I was going to try, and I'm going to talk pretty quickly because there's a lot of us. But I wanted to start with a little story and then really cover what I see as sort of the top public health issues that affect children, and then how does a public health department really help make sure that middle school age children are thriving. I want to tell Jerome's story, and I just want to let people know I do run LA County's health department now, but I also was a high school principal for a few years back in Boston. I worked a long time with John there. So I do come to this work with both a deep understanding of how our schools are organized and how they work for our children and our families, but also a deep appreciation for how the rest of us in other departments and other government agencies have a responsibility to be more supportive. So Jerome was, I met him when he was an 8th grade student. We had an academy program for 8th grade students coming into 9th grade. I was a district high school in Boston, which meant, everyone can come. There's no exams. It's really just a straight opportunity for children to enroll. Predominantly all children of color. And mostly in Boston at the district high schools, predominantly children of families with limited income. And Jerome was no different. I got to know him in our summer academy program, and he was a great kid, and he loved everything about coming and the privileges that now he was looking forward to when he was going to be a high school student. I had a health and technology academy, and he wanted to be a pediatrician. I mean, he came in wanting to be a pediatrician. The backdrop to this is almost all the children that came to our schools had really high aspirations about and desires to be contributing members. Their average reading score was at a 6th grade level entering into 9th grade, and the average math score was at a 5th grade level. So they really knew what they wanted to do, but they had been given very little support to actually be ready to do that, which is why we had a summer academy program. He didn't come for 3 days straight, and when kids didn't show up, we don't have a lot of staff, so I would go do home visits in the evening to try to figure out what was happening and why children weren't getting to school. And I went to his home. It was probably like 6:30 or 7 at night. He was glad to see me. He let me in. There's no electricity. It's like the summer, but there's no electricity in the house, which means there's no refrigerators and there's no lights. So limited food and limited opportunity to do any work in the evenings. There's also no adult in his house. There are 4 children and no adult. He lives with his mom, and his mom is working. He hasn't been coming to school because he has a sick sibling. And I think this is the common story, which really leads me from, sort of the public health perspective now to say that the biggest issues that I see impacting children, both when I was in Boston and now that I'm in LA, are big issues: homelessness and poverty. LA County, we have 59,000 homeless people in our county. About 44,000 of them are unsheltered, and about 10,000 of them are children. Up to 21. So I guess some are older or young adults. But it's a big problem, as is poverty, and the number of people who live in families where there's not enough money. Discrimination and racism, I was really glad that the earlier panels touched on this. I think this is the most important issue we together need to address. I don't see opportunities to actually narrow either an education gap or a health gap in terms of health outcomes unless we deal with this. Black babies in LA County today are dying at 4 times the rate of white babies. They're dying at a rate today that white babies didn't die of 25 years ago. So these become critically important problems for us to address. Environmental hazards, we got pollution, big time, including there's still lead coming through the pipes in our schools where children are drinking water. There's ads for unhealthy products everywhere. Juuls is a good example. We have an underinvestment in many communities in infrastructure that allows children to thrive. So you want to talk about obesity issues. There's a lot we need to do to invest in parks so that they're safe and places where children can actually recreate and their families. And there's a lot of exposure to violence, all different kinds of violence, but they all inflict trauma on children. And for many of our children, they have years and years of experience with violence in their lives. And then lastly, I'd like to say that, the school-to-prison pipeline is alive and well, certainly in California, and I think elsewhere, in terms of regressive policies in schools that make it pretty easy for children who aren't behaving appropriately in a school setting to actually enter into the criminal justice system at a very young age. So I want to keep this as the backdrop to my comments, because I think as a public health professional, our role needs to really be to help deal with these big issues, which obviously we deal with in partnership with many others, but that we can't get away with just very focused efforts in our schools if we don't pay enough attention to some of the issues that really create the context in which children are going to learn and thrive. I want to note that I was really glad also this morning to see somebody talk about the importance of having an adult that children feel like they have a good relationship with and can talk to. Because I looked at some data with our 7th grade students in LA County. We have a California Healthy Kids survey that's administered. And there's a question that asks, is there an adult that cares about you in the school? And 12% of the 7th grader respondents in LA County said that this was not at all true, that there was no adult. And as you can see from this slide, 7th graders who reported that there was no adult in the school who cared about them were 3 times more likely to have high levels of truancy, 5 times more likely to use e-cigarettes, 4 times more likely to be using cannabis, 3 times more likely to be engaged in fights, 4 times more likely to have vandalized school property on multiple occasions, 3 times more likely to have missed school due to the fact that they were bullied, 2 times more likely to be failing, and 2 times more likely to consider themselves as part of a gang. So the notion that the importance of these relationships that we do have opportunities to build, I think can't be understated. The second point is, though, which I think is equally important, is oftentimes children are engaged in multiple kinds of high-risk behaviors. And to have a strategy that really just concentrates on one high-risk behavior, we're going to teach kids, the dangers of using tobacco, we're going to now talk about the dangers of using cannabis, or we're now going to just focus on sort of a strategy that addresses bullying, I think falls short of recognizing that there's a clustering of these issues and that positive youth development is actually an approach that would allow us to think about how we're going to actually really reduce the need for young children or young people to actually engage in what can be very risky behavior. I want to flip very quickly to so what can a public health department do? I think there are multiple areas where certainly in LA we're doing some work, and I know other folks here in the room are doing some work. One is, I want to talk a little bit about community programming, because the day for middle schoolers is got to start when they wake up, and it's got to end when they get back home. And in between that, there's early care and after school care. And they're too young to not be in a supervised, supportive setting. And they're too old to go to daycare. But this is where community programming needs to come in. There need to be programs in the community, either linked with the schools or at the schools, where young people can go. We do a lot of parks programming with our Parks and Rec folks, and we make parks safe so that people can actually use them, but we also have special programming for middle school age children. We have a program called Our Spot right now. I'm a big believer in leadership, and again, I was really so happy to see this emphasized in the remarks that the middle school student made, which is, young people have voices and they have smart ideas, and we need to make sure that we're creating spaces and places, and that's one of the things that we could do from a public health perspective. Social and emotional learning. I want to emphasize this because this starts as soon as kids get into any school setting. You need to learn the skills to manage your own emotions and your relationships with others. That's a learned behavior. And we have a responsibility, starting when kids come into our school buildings, to teach that, make space for that, and have our community support that. And that's also something that we can emphasize with our parents and our caregivers as well, is helping us all learn how to better manage our own emotions and our relationships with others. Trauma, I'm not going to have time to talk about this, but I think this is one of the big issues in many of our communities, and we need to have much better strategies. But at schools, you know, cooperative discipline is a trauma-informed way to organize a school, and I'm in favor of all of the folks in the school building being trained around how to understand the implications of trauma. And this is something your public health departments can help you with. We can also help you around healthy food, and here healthy food is also around food insecurity. So making sure that those school meal programs are year-round is something public health departments should and can be helping with. And last, you know, this investment in healthy communities. You know, nobody lives alone, and our children live in a community and they live with a family. So anything we can do to support faith-based institutions, community-based organizations that are very close to the families in the community is another way we can get money out to a community to support school-age children. We see our children as leaders already, and there is a short video, it's like 1 second, that maybe we could just tee up here. So this is, we just recently passed a law.
I'm the founder.
Yeah, you can go.
Founder and president of International Youth Tobacco Control, and I'm here with my members today because an industry called Big Tobacco and an epidemic called youth vaping are haunting my community and my campuses. All the youth in support of this ordinance, please show your hands. And we are here today because our classmates are getting so addicted that they are hitting their jewels in the classrooms during class time. We are here because in my school alone, 3 students have been expelled after caught vaping. We are here because I've seen a minor reselling e-cigarettes, flavored e-cigarettes that she got from retailers. Supervisors, flavors harm kids, flavors mask harms, and flavors lure our youth into it. So we hope that LA County can stand up against big tobacco and protect our teenagers by passing this ordinance today. Thank you.
Thank you very much.
So we had 150 kids from middle school and high schools come. She's a 10th grader who led all this organizing with young people, and we actually passed a ban on all flavored tobacco products, including menthol. And I think it was the power of young people standing up, being organized, and speaking out. So anything we can do around leadership for young people, I think, makes a huge difference. Thank you.